Can kissing get you sick? Hi, my name is MediStop. Welcome to my channel. In this video we will discuss about an interesting topic, infectious mononucleosis. Infectious mononucleosis, also known as mono, or kissing disease, is a contagious illness frequent among teenagers and young adults, especially college students. What causes this illness? Basically, the main cause is the infection with the Epstein-Barr virus. This virus is named after its first discoverers, Tony Epstein and Yvonne Barr, who discovered the virus in some tumoral cells from the Burkitt's lymphoma. There are also some microorganisms that cause mononucleosis-like symptoms, such as cytomegalovirus, herpes simplex, and human immunodeficiency virus. How does Epstein-Barr virus work? Long story short, this virus affects the B lymphocytes and stimulates them to proliferate. This proliferation of the B lymphocytes will determine an activation of the T lymphocytes that will eventually destroy the infected B cells. Before being destroyed, the B lymphocytes transfer the virus to the epithelial cells, and because of that, the virus can reach the oral mucosa. From there, the Epstein-Barr virus will be found in the saliva, ready to be transmitted to another uninfected individual. What are the signs and symptoms of mononucleosis? There are three main phases. First, there is the prodromic phase, when the patient starts to experience some insidious symptoms, like extreme fatigue, myalgia, headaches, or even malaise. The kissing disease can remain at this level, but in more severe cases, can go for a more systemic approach. This phase usually lasts for 3 to 4 days. Next, we have the symptomatic phase when the patient has 4 important signs and symptoms. For a better understanding of the clinical manifestations, we will remember the signs and symptoms as SAFE. S stands for spleen enlargement, which is found in nearly 50% of the patients. Usually, it is not painful. However, if the pain appears, it is located in the left hypochondrium, and we should consider a spleen rupture. We will talk about this later. A stands for adenopathy with swollen lymph nodes. This is a very common sign being present in almost 90% of the cases. These affected lymph nodes are usually spotted on the posterocervical region, but can also be found in the submandibular or even inguinal region. They are not painful, but their size is considerably larger. F stands for high fever, over 38, that does not respond to usual antipyretic medications. Usually lasts between 1 to 6 weeks. E. Erythematous pharyngitis with or without the involvement of the tonsils. During the physical examination, we will inspect the patient's oral cavity so we can see the inflammation of the pharynx alongside a specific sign for mono, kissing tonsils. This inflammation is an exudative type of pharyngitis, therefore we can also see an outer layer, like a white blanket, over the inflamed mucosa of the pharynx and the tonsils. This symptom may last around 2 weeks. Then, there are some other signs and symptoms related to infectious mononucleosis. For instance, the patient may have hepatomegaly due to a liver inflammation, which clinically can be seen as jaundice. We also can see edema around the eyeballs in the periorbital region. This sign is positive in 33% of the patients. Nevertheless, another sign that the patient may have is a rash on his body due to the administration of antibiotics such as amoxicillin clavulinate. The exact cause of this reaction is unknown, but it is believed to be a virus-related mechanism. The last phase is the recovery phase, when the patient starts to feel better, and his symptoms are gradually disappearing. If the infectious mononucleosis is severe, the patient may also experience complications. Thrombocytopenia is a rather frequent complication, with almost 50% of the patients developing it. Splenomegaly, when the spleen is enlarged, and the risk here is represented by the spleen rupturing. This is the reason why the patients are recommended to avoid intense efforts in sports with physical contact, such as kickboxing. In severe cases, splenectomy is recommended. Neurological signs. The patient may experience aseptic meningitis. The cerebrospinal fluid evaluation can show a slightly increased number of cells, a normal level of proteins, and glucose. Additionally, the patient may also have encephalopathy, pericarditis and myocarditis, due to an inflammation that affects the pericardial sac. This can lead to heart arrhythmias, such as atrial fibrillation. Last but not least, the patient may have renal involvement based on the inflammation of the interstitial tissue of the kidney. How can we diagnose infectious mononucleosis? Well, first of all, we need to have a chat with the patient where he can list his symptoms. For instance, fatigue in the last week, high fever, unresponsive to medication, difficulty swallowing, and a sore throat. Next, we will do the physical exam that will reveal lymphadenopathy, pharyngitis, and hepatosplenomegaly. If our patient is a teenager or a young adult, we may have reasonable reason to believe that it is mono. But how can we be sure? There is a rapid test called MediStop that detects heterophile antibodies produced by the body in response to the presence of the Epstein-Barr virus. They are immunoglobulin M antibodies, but they are not very specific. In order to confirm the diagnosis, there will be other tests needed. More specific antibodies are for the VCA, which stands for viral capsid antigen. If the immunoglobulins M for the viral capsid antigen are present, we have an acute infection. Another example is represented by the eBNA antibodies. eBNA stands for Epstein-Barr nuclear antigen. These antibodies appear later in the infection, and they last for the entire life. As far as the patient's blood work goes, on his hemogram we will see leukocytosis due to lymphomonocytosis and possible thrombocytopenia. The liver enzymes and bilirubin are higher than normal. The treatment is usually symptomatic. Almost 95% of cases the patient does not require specific therapy. One important recommendation for the patient is to reduce the physical effort as much as possible. We must treat constipation or other situations that can result in harming the spleen. The patient must rest, drink plenty of liquids, and let the body's immune system fight the virus. Corticosteroids are used to treat complications, such as the severe obstruction of the airways, severe thrombocytopenia, or nervous system complications. With that being said, here we finish this episode. I hope you enjoyed it, and if you did, hit that subscribe button to never miss more content like this. If you want to check another infective disease, you should check my video about infective endocarditis. Otherwise, if you are struggling to study for your exams, you should take a look at my review on how MODAFINIL works. Maybe it will help you. Thank you for watching. See you in the next one.